Did you know that about 1 in 10 kids will struggle with a behavioral disorder like Oppositional Defiant Disorder, ODD? This means that roughly 3% of children around the world face daily battles with authority, rules, and even their own emotions. It's more common than you think, yet many parents don't even realize what's going on. ODD can feel like an unending challenge, tantrums, resistance, and constant pushback. But here's the shocking truth: your child isn't just being bad. Research shows that ODD is often linked to differences in the brain, making it harder for kids to control their emotions. So, what can you do about it? In this article, we're diving into strategies that really work. We'll explore how understanding your child's mind, using calm discipline, and focusing on positive reinforcement can turn your approach around. Ready to discover the tools you need to bring peace back into your home? Let's get started. Chapter 1. Unlocking the mystery. What is ODD really? Oppositional Defiant Disorder, ODD, isn't just about stubbornness or defiance. It's a mental health condition where children often challenge authority, resist rules, and display irritability. What makes ODD different is that it's not just typical teenage rebellion, it's consistent, and it often interferes with school, family, and friendships. A study from the American Academy of Child and Adolescent Psychiatry states that ODD affects about 3–5% of children, typically showing up around age 8. Understanding ODD is key to knowing how to manage the behavior. It's often caused by a mix of genetic and environmental factors. For instance, children with a family history of mental health issues may be at higher risk. And things like stressful home environments or inconsistent discipline can trigger ODD symptoms. But what really happens when your child pushes back? It's not about disrespect. It's about struggling to control emotions and reactions. According to Dr. Ross Greene in his book The Explosive Child, kids with ODD have a different way of processing information. They might feel overwhelmed by frustration, leading to outbursts or refusals. Simply put, they're not trying to be difficult, they don't know how to manage their intense feelings. Parents often describe their child with ODD as constantly testing limits, but it's not about manipulation. It's about survival. When these children feel misunderstood or controlled, they lash out because they can't communicate their feelings properly. This insight can help parents approach discipline with compassion. Chapter 2. When no means more than no, the science behind resistance. You've probably heard your child say no over and over, and it seems to come without reason. But there's a deeper explanation. Kids with ODD often have trouble processing authority figures and rules. Dr. Greene explains that their resistance is not a sign of defiance but a way of asserting control over their environment. The brain plays a big role here. Research from the National Institute of Mental Health, NIM, shows that children with ODD have differences in brain activity, particularly in areas related to emotion regulation. Their brain struggles to manage frustration and anger, which leads to impulsive behavior. Understanding this can help you reframe your thinking. When your child resists, it's often because they feel helpless to control their emotional state. What's interesting is that ODD kids don't just react to discipline, they react to stress. When stressed, their fight or flight response is triggered, making them more likely to rebel. This is why simple instructions can turn into huge power struggles. Instead of pushing back harder, consider backing off and offering choices. Offering 2 or 3 options gives the child a sense of control, which can reduce resistance. Dr. Daniel Siegel, a renowned child psychiatrist, emphasizes in his book The Whole Brain Child that understanding how your child's brain works can make discipline more effective. Instead of using a one-size-fits-all approach, try strategies that promote emotional regulation. When children with ODD feel in control of the situation, their resistance often decreases. Another key aspect is timing. Research has shown that kids with ODD are more likely to engage in challenging behaviors when they are fatigued, hungry, or overstimulated. So, be mindful of their environment. Avoid confrontations when they're at their breaking point. Keep the environment calm and predictable for better results. Chapter 3. Positive Reinforcement. the secret weapon you're overlooking. When most people think of discipline, they imagine punishment. However, a key strategy that works wonders for children with OD is positive reinforcement. This isn't just about rewarding good behavior, it's about catching them being good and encouraging them to repeat it. A study published in the Journal of Abnormal Child Psychology found that positive reinforcement can significantly reduce disruptive behaviors in children with OD. The trick with positive reinforcement is making it consistent and specific. It's not enough to say, "Good job." You need to acknowledge exactly what your child did right. For example, say, "I'm proud of you for finishing your homework without being asked." This reinforces the behavior you want to see again. A unique approach is creating a reinforcement menu for your child. This could include small rewards like extra screen time, a special activity, or even choosing dinner for the night. It's important that the rewards are meaningful to the child. A reward system that excites them is more likely to produce lasting results. Consistency is key here. The American Psychological Association suggests that predictable reinforcement can build positive behavior over time. Kids with OD respond well when they know exactly what behavior is expected and what they will receive for meeting those expectations. Another creative idea is to create a star chart or a similar tracking system. Children with OD often struggle with self-esteem, and seeing their achievements visually can boost their confidence. Celebrate their progress, no matter how small. This encourages them to keep trying. But positive reinforcement doesn't mean ignoring the bad behavior. It's about balancing praise with clear boundaries. When you combine this with the right discipline strategies, children with OD are more likely to internalize the behaviors you want to see. This can be a game changer, especially in high-stress moments. In the end, remember that positive reinforcement isn't just about rewarding good behavior, it's about building trust and connection with your child. As Dr. John Gottman writes in the 7 Principles for Making Marriage Work, affection fosters cooperation. This couldn't be more true for children with OD. Showing affection and appreciation fosters cooperation and reduces opposition. If you found this helpful, make sure to subscribe for more strategies and tips that really work. Let's build a better, more peaceful environment together. Chapter 4. Setting Boundaries Without Breaking Bridges. The Art of Calm Discipline. Disciplining a child with Oppositional Defiant Disorder, OD, can feel like walking on a tightrope. On one hand, you need to set firm boundaries. On the other, you don't want to create more resistance. It's all about striking the right balance between structure and understanding. Children with OD often push boundaries because they struggle to manage emotions and reactions. But setting clear limits is essential. According to the American Academy of Pediatrics, children thrive when they know what is expected of them. For children with OD, these limits should be consistent but flexible enough to adapt to their emotional state. One of the most effective techniques is to remain calm during conflicts. Dr. Ross Greene, in The Explosive Child, emphasizes the importance of staying emotionally regulated when dealing with challenging behavior. Children with OD feed off emotional reactions, and getting upset yourself can escalate the situation. If you can stay calm and composed, your child is more likely to do the same. When setting limits, avoid power struggles. Instead of saying, "You will do this right now," try offering choices. For example, would you like to clean your room now or after dinner? Giving your child some control over their decisions helps reduce resistance. It's not about giving in, it's about offering them a sense of autonomy. Remember, your tone and body language matter. A calm, neutral tone sends the message that you are in control without being threatening. Research from the Child Mind Institute shows that children with OD respond more positively to respectful, non-confrontational communication. And don't forget consistency. If one day you let something slide, and the next day you don't, your child may feel confused and unsure about your expectations. Consistent boundaries create a predictable environment, which is important for kids with OD. Above all, don't be afraid to show empathy. While discipline is necessary, children with OD often need understanding more than anything. As Dr. Daniel Siegel writes in The Whole Brain Child, children's brains are wired to be relational. When you relate to their struggles, you're more likely to see positive changes. Chapter 5. The Power of Timeout, How to Use It for Reconnection, Not Isolation. Timeouts often get a bad rap. They're typically seen as a punishment, a way to isolate the child when they misbehave. But when used correctly, a timeout can be a tool for calming down and reflecting, rather than just sending a child to their room. The key is to reframe the timeout concept. Instead of viewing it as a punishment, think of it as a chance for your child to self-regulate. When children with OD are overwhelmed by their emotions, they can't think clearly. A brief timeout allows them to step away from the situation, cool down, and come back ready to discuss what happened. According to the American Academy of Child and Adolescent Psychiatry, timeouts should be brief, usually no longer than 5 minutes for younger children. This gives them enough time to reset without feeling abandoned or rejected. A too long timeout can feel like a form of isolation, which can intensify negative emotions. Dr. Green advises that during a timeout, it's helpful to stay close by. Let your child know that you are available for support once they are ready to talk. The idea is not to remove affection but to offer a safe space to regroup. This can actually strengthen the parent-child bond over time. To make the timeout more effective, create a calm corner in your home. This can be a quiet area with soft lighting, pillows, and maybe a few calming toys or books. The calm corner serves as a reminder that the timeout is about regulating emotions, not punishment. Timeout should always be followed by a conversation. Discuss what led to the behavior and work together to figure out how to handle it next time. Research shows that after a cooling-off period, children with OD are more likely to be open to problem-solving. Ultimately, the goal of a timeout is to teach your child self-control and coping skills. In The Explosive Child, Dr. Ross Greene says, the goal is not to punish children for their behavior, but to help them learn how to handle frustration and anger without reacting impulsively. Chapter 6. Parenting Self-Care. How your calm can be the key to their calm. When you're raising a child with OD, it's easy to get caught up in the chaos of managing challenging behavior. But in order to be the best parent for your child, you must first take care of yourself. You can't pour from an empty cup, and your emotional state directly influences your child's behavior. In The Whole Brain Child, Dr. Daniel Siegel and Dr. Tina Payne Bryson emphasize that parents must model emotional regulation. If you're overwhelmed and stressed, it's hard to remain calm in difficult moments. This can cause your child to mirror your emotional state, which can escalate the situation. Taking time for self-care isn't selfish, it's necessary. Research from Psychology Today shows that parents who practice self-care are better able to respond to their child's needs with patience and empathy. Simple practices like taking deep breaths, exercising, or even spending time with friends can help reduce stress and improve your emotional well-being. One effective strategy is mindfulness. Studies show that mindfulness can help parents manage their reactions and improve their relationship with their children. By taking a moment to pause and breathe before responding to challenging behavior, you can stay calm and avoid reacting impulsively. Another important aspect of self-care is seeking support. Don't be afraid to ask for help from family, friends, or a counselor. Parenting a child with OD can be isolating, and having a support system is crucial. In Raising an Emotionally Intelligent Child, Dr. John Gottman reminds parents that it takes a village, and having people to lean on can make all the difference. Also, don't forget to celebrate your wins. Parenting a child with OD can be exhausting, and it's easy to focus on the struggles. However, recognizing small successes, both in your child and in yourself, can help keep you motivated. In the end, the calmer you are, the calmer your child will be. As Dr. Laura Markham points out in Peaceful Parent, Happy Kids, when you're calm, your child feels safe. When they feel safe, they're able to regulate their emotions. So, by taking care of yourself, you're not only helping your own well-being but also creating a more peaceful environment for your child with OD. If you found these strategies helpful, don't forget to subscribe for more expert advice and practical tips. Together, we can create a calmer, more understanding environment for your family.